Okay. Good afternoon, everyone. I am Dr. Zahid Hussain, a consultant pediatrician from S&M Hospital, Leh. And today I am delighted that Adil Bhai and Neha ma'am gave me this opportunity to speak on this occasion of Swachhata Pagwada or Swachhata Week being observed all over India, and on the topic of health and hygiene. As we have all been listening since our childhood, that cleanliness is next to godliness, and cleanliness is the first step towards health, and hygiene is the two-third of the health. And to keep ourselves healthy and ourselves and others healthy and our environment healthy, we need to do certain proper personal, environmental, food, water, hygiene, and cleanliness, so that we can prevent the communicable diseases from occurring. These communicable diseases spread by various routes like respiratory route. As we all know, these days coronavirus is going on all over the world. Other than coronavirus, there are other respiratory viral infections like flu and common cold and other bacterial infections like tuberculosis and diphtheria and whooping cough. These germs also spread by respiratory route. Then we have these foodborne illnesses like food poisoning caused by various germs and various toxins and chemicals. Then we have these waterborne diseases like cholera, typhoid, hepatitis A, amoebiasis, etc. And then there are other communicable diseases like vector-borne diseases like malaria, the malaria, dengue, chikungunya, etc. So, to avoid or to keep minimize these communicable diseases, there are certain hygienic principles and practices that we all of us has to follow so that we can minimize the spread of these infections. So the good hygienic principles are can be divided in many ways, and one of the ways is we can divide these good hygienic practices like personal hygiene that includes bathing daily. Bathing daily not only prevents this bad odor and smell from sweating and bacterial fermentation. In addition to that, bathing prevents other communicable diseases like scabies, pediculosis, various fungal infections, and eye diseases like trachoma, etc. One should bath with soap and running water and clean the body, dry the body with a dry towel, and the towel should not be mixed with other persons. Then we have hand hygiene. The importance of hand hygiene, everybody knows these days, ever since the coronavirus pandemic. It cannot be, it is so important that one has to practice proper hand hygiene techniques. There are various seven WHO steps of proper hand hygiene. All of us knows that, and soap should be used, and running water. If soap is not available, then WHO advocates using ash for hand hygiene, and hand should be dried with a dry towel or a tissue paper. And there are various viruses and bacteria that remains alive for from 20 minutes up to many hours on hands and other surfaces. So we have to keep the hand washing practices. And hand washing should be done after toilet, before or after eating food, touching animals or touching baby diapers, etc. And after having during illnesses like cold, flu, the hand washing should be done after every touching the nose or throat, etc. So nails and nails of the hand and feet should be cut. And there are other personal hygienes include dental hygiene that my colleague Dr. Mustansir will be talking in depth. Then other measures like regular exercises is also part of good hygienic practices to keep ourselves healthy and well-being. Then there are sleep hygiene that also is very important to maintain our physical and mental health. At least we should have 6 to 8 hours of proper sleep, and avoid tea, coffee, and cigarette smoking, etc., just before going to sleep. And then there are other aspects of personal hygiene like mental hygiene, sexual hygiene, menstrual hygiene, etc. And we all know the proper respiratory and cough technique, etiquettes, and sneezing etiquettes during this flu season or coronavirus season, the practice of social distancing, um, avoiding overcrowded places, etc. Other than personal hygiene, there we all know that food hygiene is another very important aspect of keeping ourselves and others healthy and wealthy. Freshly and properly cooked food should be utilized. Food should be nutritious in all aspects. One must avoid old cooked food. Cooked food should be covered to avoid fleas and cockroaches, and cooked food should be stored in a refrigerator if possible. Avoid plastic or other street vendor foods, and one should properly wash vegetables and fruits before eating, and hand hygiene practice should also be practiced. Then we have another aspect of cleanliness or hygiene is the water hygiene or sanitation. As we all know that jal hi hai to jeevan hai. So one clean water source, clean water container like buckets, clean hands and closed water container should be used at home. Bucket should be closed, and if possible, boiled water should be used. And one must also keep in mind that water wastage should be minimized, as we know that water scarcity is happening all over the world. And water storage facilities like Sentex and tubes or wells or bucket, etc., where water are being stored should be covered so that mosquitoes don't breed there to avoid vector-borne diseases. Then another aspect of good hygienic practices are the good housekeeping. As we all know that the house should be properly ventilated, and if possible, sun should be allowed to come inside the house, sunlight, so that these germs may be killed. But this practice is not as advisable these days at places like Ladakh in view of the severe cold. In the houses, there is a lot of generation of waste products, what we call as a kuda kachra, and these should be disposed of properly and from the source of generation. And these waste products should be segregated into wet, dry, and plastic or chemical waste products. Wet waste products like vegetable remains of vegetable, fruits, food items, etc., should be covered, and these may be used as a fertilizer in our agriculture fields. And plastic and chemical or other toxic waste products like medicines, etc., should be properly segregated and disposed of as per the rules. Then we have another aspect of proper hygiene or the environmental and sanitation, including toilets, as the week Swachhata Abhiyan or Swachhata Pagwada going on in India. This Swachhata Abhiyan program was launched by our Honorable Prime Minister in 2014, and toilets are being built and have been built all over India. And open defecation should be minimized as much as possible. In addition to this, there are other hygienic principles that we should keep in mind to avoid diseases like noise pollution or air pollution. And coming to being a medical person, the hospital waste products, hospital infection practices are very important, especially the waste management, biomedical waste management in the hospitals, and infection control principles. We in Leh Ladakh, our hospital, SNM hospital at Leh, and some of our peripheral hospitals like SDH Nobra and SDH Khalsi has been awarded as a winner in the National Kaya Club competition for cleanliness and proper biomedical waste management for last many years by the government of India. And SNM hospital has been has been the leading hospital in terms of cleanliness and hygiene, proper waste disposal. Among the best hospitals, not only in India but even in Europe also. And in the end, I would like to say that having said all this, there is a flip to the side of the story that, like everything, excess of everything is bad. There is a debate going on in the Europe and America regarding the excess hygiene, whether the excess hygiene can lead to some other diseases, like the hygiene hypothesis. There are certain research reports and a lot of research are going on this aspect that excess hygiene and no these childhood infections like gastroenteritis, respiratory infection in childhood may lead to some other diseases in adulthood like asthma, allergy, and autoimmune disorders. But these are only hypotheses, and we all have to properly implement these proper hygienic principles to keep ourselves and our environment and our mother earth health, keep and clean. And I'm again very thankful to the team for providing me this opportunity. Thank you.
Thank you, sir. It was really an informative speech by you, sir. Dr. Zai, sir, talked about cleanliness. He talked about communicable disease, respiratory infections, vis-a-vis COVID. Dr. Zai Hussain, sir, also talked about the food poisoning. He touched upon the waterborne diseases and vector-borne diseases. And he also informed us about the importance of bathing daily so that we can prevent ourselves from communicable diseases, being swatch, being clean, being hygienic. Dr. Zahid Hussain sir also talked about hand hygiene as well as the WHO advocating points regarding hand hygiene. Dr. Zahid also informed us about if we don't have soap or any other cleaning agent, we can use ash for cleaning our hands as per WHO guidelines, as well as sir also talked about the regular exercises, sleep hygiene for better mental health, as well as not using tea or coffee before sleep. Sir also talked about mental, menstrual, and sexual hygiene. Also, sir talked about COVID vis-a-vis cough, sneezing, etiquettes, maintaining social distances, avoiding crowded places. Sir also talked about the food hygiene, using freshly cooked, properly cooked food, clean food. Sir also gave some points on sanitation, clean water sources, using of clean containers and boiling water before drinking or using it. And sir also talked about the minimal use of water, stopping the wastage of water. Also, sir talked about open defecation, which is also a big problem in our country. And if we stop the use of open defecation, it can stop a lot of communicable diseases. As well as sir also talked about pollutions in air and air, noise, and water. Sir also talked about his own hospital, S&M Hospital there, that it being a leading waste management hospital and has been ranked one of the cleanest hospitals in India as well as per European standards. And sir also at last talked about the excess hygiene, which actually many people have that bad habit of cleaning a hand more than 20 times a day, more than 30 times a day. It creates actually creates a negative effect. Those people actually get sick of this. They think that everything we touch, we become dirty, but that mentality should not be there. I would again like to thank Dr. Zahid sir. Now I will request Dr. Mustan.
Thank you.
Just out of turn, Adil, because I missed the introductory session. I'm sorry, my esteemed guests as well as the participants. The internet was a little sloppy, and I